Requirements for academic residency program in physical medicine and rehabilitation, the School of Medicine, the University of Jordan. Physical medicine and rehabilitation academic residency program is a medical specialty concerned with diagnosis, evaluation, and management of persons of all ages with physical and or cognitive impairments and disability. This specialty involves diagnosis, treatment of patients with painful or functionally limiting conditions, the management of comorbidities and co-impairment, diagnostic and therapeutic injection procedures, electrodiagnostic medicine, and emphasis on the prevention of complications of disability from secondary conditions. Physiatrists are trained in rehabilitation of neurological disorders and in the diagnosis and management of impairments and musculoskeletal conditions, including sports and occupational aspects, and other organ systems, and the long-term management of patients with disabling conditions. Physiatrists, they provide leadership to multidisciplinary team concerned with maximal restoration and development of physical, psychological, social, occupational, and vocational functions in persons whose abilities have been limited by disease, trauma, congenital disorders, or pain to enable people to achieve their maximal functional abilities. The curriculum consists of 4 years of residency to successful candidates who are medical school graduates. The program includes 1 year of internal medicine department, which should include rotation to neurology, rheumatology, and cardiopulmonary departments, and should pass the examination at the end of this year. 3 years of rehabilitation education in its various rehabilitation subspecialties, including inpatient, outpatient rehabilitation department. A final examination is held at the end of each year and includes written, oral, and clinical examination at rehabilitation department. At the end of the program, the candidate should have adequate knowledge of the detailed anatomy of the musculoskeletal and the neurological systems, adequate knowledge of the central and peripheral nervous system, adequate knowledge of the physiology of the human systems and special emphasis on muscles, nerves, and body fluids, adequate knowledge of kinesiology and biomechanics, adequate knowledge of the diagnosis of the skills of the rheumatic diseases, metabolic, bones, and joint disorders, diagnosis and management of various musculoskeletal disorders, diagnosis and management of the nervous system disorders such as spinal cord injuries, traumatic brain injuries, and strokes, adequate knowledge of the pain management techniques, adequate knowledge of electrodiagnosis, scientific principles of physical medicine and rehabilitation, pharmacology, and the drugs that most commonly used in this specialty. As a conclusion, the academic program of physical medicine and rehabilitation is a unique program that gives you the opportunity to get a higher specialization degree in this important field. And after completing physical medicine and rehabilitation residency, you will be eligible to take the certification examination offered by the Jordan Medical Council, and you will be eligible for the European Board in Physical Medicine and Rehabilitation.